Okay, so I wanted to go ahead and end the previous lecture. At that point in time, it was getting a little longer. Or in the second part of the lecture, I'm going to talk about purging and some of the other behaviors that occur during bulimia nervosa. So first of all, we see purging, which is self-induced vomiting, and it's most commonly used compensatory behavior in about 80 to 90% of bulimia nervosa patients. However, the thing to realize here is that about 33 to 75% of the calories are still absorbed. So you're not really getting rid of that many because that at what time has the patient purged? After the meal? Is it right after? Is it, an hour later? So depending on that time frame, it could be anywhere from 33 to 75% of the calories that have already been absorbed in the body, and then you're getting rid of the rest. Usually the way it occurs within a patient is that they put the fingers down the throat, so that's why you get the damaged knuckles and the Russell sign that we talked about. Some of the ways that purging occurs are through materials that allow purging to occur. Syrup of ipecac is one of those, and it has really bad side effects. Like it's really toxic to your heart, it's really toxic to your liver, your kidneys. If you take it repeatedly, it can be poisonous. I mean, it builds up to that level where it can be really, really bad for your body. It will damage your blood vessels, not just within your guts, but also in your neck, in your face. And it will completely erode your teeth. So, I mean, you're going to get rid of all your teeth. It's enamel that's going to go bad. So there's definitely a lot of side effects. In fact, for syrup of ipecac, but we see that being used as the number one choice among patients who are suffering from bulimia to engage in self-induced vomiting or purging. We also see the usage of laxatives, which act on your large intestine, and this is where 90% of the calories are absorbed in the small intestine. But when the patient over and over utilizes laxatives just as a way to get rid of, calories, they're not really getting rid of a lot of calories because at that point in time, 90% of the food has been absorbed in form of calories within the small intestine. So what you're, whatever is the remaining that has gone into the large intestine, that's what you're getting rid of. And overusage of laxatives actually damages your large intestine, starts causing constipation. We also see diuretics. Now, it's very important to realize that there is no calorie loss that occurs with diuretics, only water loss. In fact, only electrolyte loss. So you don't have any fat loss. And when we talk about those yo-yo diets or, the 10-day diets, 10 weight, 10 pounds off type of things, I mean, they get popular, they surface the internet, your Pinterest, all of those things. And usually what they're targeting at is this weight loss that would, this water loss that would occur within those early days. So a lot of times patients just to, lose weight quickly also engage in diuretics. However, it's important to realize there is no fat loss. Again, we see the patients engaging in excessive exercise, and this compulsive exercise, it continues despite injury or any other medical conditions where the patient actually not completes exercise or does exercise because of this fear of weight gain. So it's not necessarily just to maintain a healthy body, but because of this fear of weight gain. Overall, it's a very vicious cycle. It starts with anxiety, where the patient feels really anxious and they find comfort in doing something that their brain has done before. So it's a repetitive behavior. And if you notice anything about brain chemistry, it's that if you engage in a repetitive behavior, it allows you to calm down. It allows you to take out that stress, even though that behavior might not be good for your body. So again, anxiety leads the patient to engage into that repetitive behavior, which is binging. And then the patient, all of a sudden, after, in conclusion of that episode, a binging episode, the patient now has this fear of fat gain. And because they have this fear of fat gain, then they engage in a purging episode or any of the other episodes, compensatory methods that would allow them to get rid of all the calories that they had consumed in the binging episode. Now they have a loss of fear of fat gain, right? After, let's say, they engage in purging. Well, they got rid of, some of the content that they ate, and the fear of fat gain is no longer there. However, what has taken its place? And it is this feeling of guilt. It is this feeling of guilt that once again, they had to resort to this particular compensatory method. If you remember, many of the bulimia patients recognize that this is not a healthy behavior. And once they engage in them, it fills them up with guilt, which then induces further anxiety. And then that anxiety again, causes them to binge again. So do you see, it's a cycle. It's a really vicious cycle, and it goes on and on and on and on and on until the patient realizes that this is unhealthy and that something needs to be done about it. So as far as treatment goals are concerned, you want to have weight maintenance for sure. For bulimic patients, weight gain is usually not the highest at the highest priority. The reason being that usually patients are in that safe zone where their weight goes up and down, up and down, up and down, up and down. So the goal and the idea here is to making sure that the patients maintain their weight in a healthier category, and that they stabilize their eating habits. Or again, you're working on a lot of those psychological habits where their patients are getting rid of the unhealthy behaviors, unhealthy mental contributors, unhealthy eating behaviors. I also wanted to discuss the 5 warning signs of childhood eating disorders. Our course is focused on children and adolescents, and although majority of the lecture and this lecture we discussed, signs and symptoms that would fit the adolescents or the teenagers, it is important to understand that eating disorders also occur among children, and there are warning signs that we need to be aware of. So the first one being decreasing weight goal that stunts the growth. So for example, if a 5-year-old is supposed to weigh about 40 to 42 pounds, not consistently meeting that goal from, let's say, the age of 3, that's a huge point of investigation, especially if the growth is stunted because of not gaining weight or not maintaining or not reaching the weight goal, the designated weight goal for their age. Also, increased self-criticism of the body. If you see a 6-year-old talking about how they don't like certain aspects of their body, and it's not just, oh, I don't look good today. It's a constant, repetitive self-criticism of the body. Followed with increasing social isolation, where children specifically love to engage in social play. They love to hang out with their peers. But if you see that a child constantly isolates themselves in social settings, prefers to be alone, does not necessarily prefer to play with other children or individuals of their own age, then that's something to think about. It's a red flag. Now, moving on from, the age of late childhood to early adolescence, the age of 10 or 11, where the child may hit puberty early on, and all of a sudden there is a disruption of menstruation. Let's say a 10-year-old, it's very common nowadays that at the age of 10, some of the girls may hit that puberty age early, even at 10 or 11. And let's say at the age of 12, all of a sudden there is a disruption of menstruation. Upon a physical evaluation, fortunately, there are no signs of pregnancy or anything like that, but you can't really figure out what's going on. Why has the child stepped into amenorrhea at such an early age? And that could be a point of investigation for, is the child possibly suffering from an eating disorder, especially if it's combined with all of these other warning signs. And the last one is reports of purging in the context of dieting. This is actually pretty important, and the reason is, a child may engage in purging, self-induced vomiting, or anything along those lines, and may not actually know that that's an unhealthy behavior. They may think of it as, oh, I'm dieting, or I'm, maintaining my weight this way. They may not know that this is an actually addictive behavior that's unhealthy for their body, and if not treated in time, it will stay with their body for a very, very long time. If you recall from the documentary Thin, Brittany, when she started purging, she actually didn't know that that's what it was. She just thought she was dieting, and then she shared it with her mother, who was also doing the same thing, and then her mother told her that, wait, this is not dieting, this is not maintaining your weight, this is actually an unhealthy behavior. So reports of purging in the context of dieting is very important. Looking at the prognosis, so the good thing is that the mortality rate has declined for anorexia nervosa. It used to be about 10%. It has gone down to 2%, which is good. However, we're looking at patients who do survive from anorexia nervosa, that they have this lifelong struggle with food. 20 to 30% patients, they keep going back and forth between these episodes, highly active episodes of anorexia to, where they're having a better hang of it. They are able to handle it better. We also see that patients do need long-term counseling, psychotherapy, cognitive behavioral therapy. This is again very important for bulimia patients as well. They have to correct the underlying self-images and beliefs about themselves. Family counseling can be very useful as well for both anorexia nervosa and bulimia patients. Now, here's the problem area. The only problem with this eating disorder is we have a very high relapse rate. Patients oftentimes, when they graduate from the facility, they fall right back into the same behaviors, same routines. And why is that? When you go back to that familiar situation of your home, or that familiar setting where you came from when you seeked help. That nostalgia itself can sort of recreate, can put you back in that situation where you want to again engage in unhealthy behaviors, especially if it's a toxic environment, if it's a toxic living situation to be part of. If you're going back to that, that can actually be harmful to the recovery that you've done at a treatment center. So it's very important to making sure that the environment is also getting cleared and is healthy for the patient to go back into. That sums up our lecture for today. We had part 1 and part 2 for eating disorders. I told you ahead of time that this is one of our longer lectures for this week. If you have any further questions, you can contact me via email through my SFA or D2L. Other than that, have a great day. Thanks. Bye.